The Registered Nurses Association of Ontario is marking Nursing Week with a new report suggesting the nursing profession is in trouble. The report is based on a survey that spoke with 5,200 Canadian nurses, most of them from Ontario. It found that 75% of respondents classified themselves as being burnt out. Joining us live tonight with their reaction, intensive care registered nurse Birgit Umaigba, along with co-hosts of the Gritty Nurse podcast, Sara Fung and Amie Varley. Birgit, I'll start with you. Troubling findings here. Walk us through your firsthand experience for you and your colleagues. What is it that's really pushing so many people to the point of being burnt out, and how dire do you see it right now?
Thank you very much, Scott. This is not surprising. We've been talking about this for how long now? Almost 3 years, and even way before the pandemic. But the pandemic has really shone a light on how frail the healthcare system is. And when it comes to nursing shortage, this situation has got worse. We have nurses leaving every day. This week alone, I met 3 colleagues who left critical care to other parts of the hospital. And it's the same thing. The workload has increased. The pay is not commensurate to the workload. People are tired, constantly working short staff. Like, this is not sustainable. And there's actually no support. And the fact that we have a Bill 124, that's capped our wages for such a long time, despite so many calls to repeal that bill. It's just so disrespectful. I'm not surprised that 75% of nurses are thinking about, even leaving the profession, or saying they're burnt out. And then again, the word burnout doesn't do justice to what we are feeling. I think we have to start naming the symptoms: depression, anxiety, fatigue, just complete tiredness. So I'm not surprised that that's the percentage.
Yeah, just to follow up with you, Birgit, if you don't mind, what have you felt during this time? And talk a bit more about what you mean about burnout and how you need a bit more specific in terms of a term. Is that too vague?
The term is really vague. It doesn't do justice to what we are feeling. I have felt tired on so many occasions. I felt this exhaustion that a lot of times I can't even describe. And it's across the board. So many nurses are feeling the same way. And we've been talking about this for so long that it's become really exhausting, repeating ourselves. We have nurses actually currently depressed and anxious and just not knowing what to do, because I walk into my unit and I'm slammed with unreasonable, unsafe assignments. It's just so stressful going into work, because you're either fighting to have a safe assignment. That's basically all my shifts. The other day, I was assaulted by a patient, and that was after 6 hours of no bathroom break, 6 hours of no water break. And to crown it all, a patient experiencing confusion, punched me on my wrist and whipped me on my face with the oxygen prongs and everything. It was so devastating. And you think there's support, there's actually no support. So this is what we're facing. And because of the short staffing, nurses are facing increased levels of violence at the workplace, and there's no support. So burnout doesn't do justice to what we are seeing, what we're experiencing, and the trauma that we have to deal with.
And as you've been saying, this has been getting worse throughout the pandemic, and obviously it was before the pandemic. Now, Sara, Birgit there talked about depression and anxiety. That's how a lot of people feel. The study talks about high work demands throughout this health emergency with little support from employers and government. Talk about the physical toll and the mental health impact.
Well, I think first and foremost, mentally, it's completely exhausting right now to be a nurse. We are running on beyond empty. There's just no end in sight, and we're talking about 2.5 years into the pandemic. Every nurse right now is working in crisis mode. We have very little to no support. It's kind of ironic that it's Nurses Week this week, because I don't think any nurse really feels like celebrating right now. And we really haven't seen any tangible action for a very long time. So we need more mental health supports, first of all. We need more awareness brought to mental health, that mental health is health. I would argue that it's just as important, if not more important, than physical health. And nurses have really borne the brunt of this pandemic. We provide provide the majority of the care. We have really felt disempowered throughout this whole experience, and we really need to see some tangible change, or this number of 75% is going to go even higher.
So, Amie, how do you deal with the severe effects of burnout and everything that goes along with it? And also, you still have to keep working. You have to do your job, even though you're feeling this way.
Yeah, I mean, I think really we're relying on each other, which is the sad part. A lot of the conversations we have are between other nurses saying, because they truly fundamentally understand. But what we're trying to get is for other people to understand the tremendous amount of stress and pressure this puts us under. And like Birgit said, burnout is not the accurate word. There are many nurses that are off because they're off on mental health leave. They're off on mental stress leave because the last 3 years have been devastating. And the one thing that I would like as a call to, I think when we talk about healthy public policy involves also having a healthy workforce. And that means having healthy nurses. So again, we have to talk to, people who are out there that can, vote, that can talk about supporting nurses to really raise their voices, because we are drowning right now. We are asking for help. We're at a very critical time where there's an election, and there are three candidates that are talking about repealing Bill 124, and there are some candidates that haven't even mentioned it. We need to see that public show of support. If you were banging pots and pans for nurses at the beginning, please start banging them for us, going out and voting and really making sure that you support us as nurses.
Yeah, definitely. We all remember back to the early days of the pandemic, there was that show of support, but obviously, as you said, it's not something that you feel 2 and a bit years into this. So, Birgit, the report clearly states nursing is in crisis. Where do you see your profession if the stress and burnout is not addressed?
I'm actually very scared for nursing, and this is every day. This is a conversation that I have with my colleagues in the staff room, like pretty much all the time. The future of nursing right now is really bleak. If strategies are not put in place, I'm talking about innovative strategies to not only recruit nurses, but to retain more senior nurses. We have so many senior nurses with 25 years experience that have left the bedside. And right now we're scrambling to mentor the newer nurses. And it is very dangerous to have only newer nurses on the floor, on any unit, any given day. We're talking about patient safety. We're talking about people's lives. We're not talking about dummies. These are real human beings. So I'm really worried that if strategies are not put in place to actually be implemented, we're going to have like a complete collapse of the healthcare system. We're already seeing that. We're seeing people waiting in the hallway for hours. And why? There are no nurses. We've heard about beds being, assigned, more beds being provided for hospitals. Beds are not nurses. You need a nurse. You need a nurse to be able to make that bed useful. Beds are just furniture. So we need strategies to retain nurses. We need we need incentive bonuses to keep nurses. We need Bill 124 repealed. We've seen that out of all the parties right now, only the Conservative Party hasn't mentioned repealing Bill 124. So that is really worrisome. All the major nursing organizations have talked about repealing Bill 124. Nurses have gone to rallies just to have their voices heard about repealing Bill 124. So why is that not important to a certain party? I don't get it. So we need nurses at the decision-making tables to be able to address these concerns. And just like my colleagues said, Sara and Amie, we need mental health resources deployed to nurses at the time when we need them.
So, Sara, talk about your experience seeing so many of your colleagues leaving the profession for many of the same feelings you're probably having as well.
It's really disheartening. I've said before, it's a very dark time in nursing right now. I don't think our profession has felt this low for a very long time. And one thing I do want to add is there are a number of nurses leaving, but there are a lot of nurses who actually do want to work in the hospital system. But a lot of times they're being told that either they don't have any hospital experience or they don't have enough recent experience. And I think we need to be more creative and broad in our approach to having nurses work in any different setting.
And so finally, Amie, from your experience, what do patients need to know 2 and a bit years into this pandemic about how nurses are feeling and how we can help?
Yeah, that's an excellent question. Today's actually International Nurses Day, and I think this is something that I could say globally all nurses want patients and families to know. One of the things that the Canadian Nursing Association has hashtag for Nursing Week is that we answer the call. And we have continued to answer the call. We will continue to answer the call, but we also need the public to answer the call for us as well. We want to have that support from the public to understand how damaging and how difficult this has truly been. We need people to go out and vote for people who support nurses. Right now, we're not feeling a lot of support, and we need the public to start really pulling together as a community to help support nurses. And again, we do want Bill 124 repealed. And again, at the end of the day, no matter what, we will answer the call and we will always be there to provide support. But right now, we are asking for that support from our patients and families as well.
All right, a very important conversation to have. We have to leave it there right now. Birgit Umaigba, Sara Fung, and Amie Varley, thanks so much for joining us tonight.
Thank you very much.
Thank you for having us.
Thank you so much.